anatomy, musculoskeletal system, ethmoid bone. The ethmoid bone is a very special bone because, to a minor extent, it contributes to the formation of the skull base, but it is also articulated with the whole facial bones. The ethmoid bone is also difficult to observe as, to see it, we should remove most of the facial bones. As you can see, it's not easy to describe since, although quite small, it has a series of foramina and cavities inside. But let's go see it in more detail. Here, you can see the ethmoid on its own, detached from all the other bones of the skull. It seems to have a rather irregular shape, but it is actually easy to describe if we divide it into aspects. The upper aspect looks like this. We can observe a very thin lamina called lamina subrosa, which is a series of microscopic foramina where the bundles of the olfactory nerve run. Note that this is the roof of the nasal cavity. This lamina represents therefore a thin layer of demarcation between the nasal cavity and the endocranial cavity. In the middle is a ridge called crista galli. Also, if we look at the lateral portion of the upper aspect, we can see incomplete cells, which are close by the cells of the ethmoidal notch of the frontal bone, as we saw in the previous video. If we look at the ethmoid bone from the front, we can see this vertical structure called perpendicular lamina. The perpendicular lamina protrudes downwards and articulates with the vomer, the bone of the facial bones that divides the internal nasal cavities. Finally, we can see that the ethmoid has two lateral masses, also called ethmoidal labyrinth, and the reason is pretty clear if we dissect the bone. As you can observe, interiorly it is made up of numerous round-shaped structures in communication with each other, as well as to the orbit and the nasal cavity, as they are, once again, paranasal sinuses. Overall, the ethmoidal labyrinth is parallelepipedic, with a major longitudinal axis. As for the outer aspect below, it has a non-sinuate structure called unsinuate process of the ethmoid. Instead, the larger laminar structure, the lateral wall, is called lamina papyracea due to its thinness, through which, backlit, we can see the cells that are inside. In addition, this structure helps to form the medial wall of the orbit. The interior and superior aspects of the ethmoidal labyrinth are rather flat and have some protuberances that are due to the cavities contained within them. But what is really interesting is the medial aspect that, as you can imagine, contributes to forming the lateral wall of the nasal cavities. Let's go see it by dissecting the ethmoid bone so that we can bring it to the sural aspect. Here, as you can see, there is the perpendicular lamina. If we remove it, we can see the medial structure of the ethmoidal labyrinth. As you can see, the medial aspect of the ethmoidal labyrinth features some conchae, the superior nasal concha and the middle nasal concha. These conchae divide the nasal cavity into different parts in order to increase the epithelial sural aspect. Below the superior nasal cornetto, there is a foramen called superior meatus. The superior meatus gets the outlet of the superior ethmoidal cells and the cells inside the sphenoid. Instead, below the middle concha, we can observe the middle meatus, which corresponds to the exit foramen of the ethmoidal bulla. On the lateral orbital aspect interfacing with the frontal, two foramina are formed, anterior ethmoid and posterior ethmoid, through which the cells can communicate with the orbit, and the passage of some vascular nervous structures is granted. The ethmoid bone is therefore a very small bone, but at the same time very complex and important from a functional point of view. This video was created thanks to Anatomy Learning, an interesting free web app. The hyperlink can be found in the description. Instead, the text used for the concepts is Human Anatomy of Eddie Hermes. Thanks for watching.